Hello everyone, I'm here 2 weeks post my fusion surgery of the L5-S1 disc, and so far so good. Everything has been above what could be expected, so I'm very positive. The surgery itself went without any complications. It was a success, and the recovery period has also been great. Even though if it's really early in the recovery period, I've only had minor pain issues. Prior to the surgery, I had severe lower back pain and radiating pain down my leg and buttock, and this has become much better. And I would say that it's maybe only about 20-30% maximally of what it was prior to surgery. Of course, I still have some local stiffness in my back, especially when sitting for prolonged periods of time. And when I say prolonged, I mean 30-40 minutes, and that's often enough to irritate it. I can still walk more than 10,000 steps every day. I walk a lot in the home. I help with the cleaning. I help with making food, and I can play with my 1-year-old daughter, although I can't pick her up because she's too heavy for me to lift yet. But I can lay on the floor, on the stomach, or on the side and play with her, so that's great. And when it comes to pain medication, I'm only taking paracetamol right now, something similar to Tylenol in the US, which is a mild painkiller. After 1 week to 8-9 days, I dropped the morphine medication because I did not experience any severe pain, so there was no reason to take it. I also stopped my muscle relaxant medication, and finally I also dropped the ibuprofen. Here in Denmark, we're a bit more loose about taking ibuprofen post-surgery when it comes to fusion surgery, because there is no hard evidence that taking ibuprofen for prolonged periods of time will inhibit the bone fusion rates. But there are definitely some worries that this might be the case, and that's why I can see on international and US sites that many places who perform this surgery recommend patients to avoid this medication post-surgery. Being a doctor myself, I examined the literature in this field when it comes to this subject, and what I could see was that there is no studies conducted on humans that show impaired fusion rates or bone healing while taking ibuprofen or other non-steroidal anti-inflammatory drugs for prolonged periods of time. But there are studies done on mice who show it, and I know that you can't always extrapolate results on mice studies to humans, but nevertheless it was enough for me, especially my low pain levels taken into consideration, to drop ibuprofen and to minimize the risk of anything going bad. So all in all, I'm doing good on simple and very minimal pain medication. I even have to watch out sometimes because I forget that I've had surgery done, especially in the night and in the morning, where I can forget it because my pain levels are so relatively low, and that can lead me to do some movements and bend my back, which I'm not allowed to do for the next 3 months. So all in all, everything is above expectation. So what is the plan for the next period of time? It is to stay on total sick leave, and hopefully I will return to my job 6 to 8 weeks after surgery. In 4 weeks, I'm going to have an x-ray of my lower back. They're gonna test if everything looks okay, if the fusion process has begun. And if everything looks okay, the screws are positioned in the right way, they will release me to further physiotherapy. And I look forward to doing more exercises. I will also use my sick leave to fill myself with positive stuff. I'll use my time with studying other areas that I'm interested in other than my job, to learn new things, and to use my time in the most constructive manner I can. So I hope to keep you updated, and the next video will probably be about 1 month post-surgery. And if you're going to have a surgery like this, I recommend you to stay positive, be patient, even though if your experience will maybe be different than mine and you will have more severe pain, then remember, at least it's better to be on this side of recovery after the surgery than before. And I hope that everything will go good with the surgery and the recovery period for you. So I don't really have much more to say for now, so I'll wish you all the best.